Welcome, guys. So welcome. This is a little special edition that I am doing for those of you that have survived cancer. Okay, so I'll give everybody a few minutes here to get on before we start talking. Okay, so you could do all of these sitting on a chair. You don't need any equipment for any of this at all. So if you're brand new to this, please just leave a little hi. I'm not going to harass you, just so that I know who's here. And then if I do more on breast cancer, I can just let you know when that's happening. Hey, Carol. Hey, Kathy. So I know MJ might be still doing her painting, so she might pop on or she might watch it later. There's a couple other ladies that had contacted me that will hopefully find this. If not, I'll send it to them afterwards. Okay. So I'm going to chat a little bit. So the two of you that are on here now, it's been a long time. I know, Carol, I see you wearing your sleeve all of the time. Kathy, I'm not sure if you do. Okay, but we're just going to talk about lymphedema. Okay. So you understand what lymphedema is. That can be a whole other video, but basically when you remove the lymph nodes, the fluid that would normally drain through proper movement of your arm is either limited or not working at all. So to have that lymph drained is something that you have to do with either gentle movements or special massage. And when you don't drain that, the arm swells. Right. And it's not just a matter of, oh, my arm swells. Geez, doesn't look good. It can be extremely painful. It can get to the point where you can barely move your arm. So it is something that you definitely want to prevent. Once you've experienced lymphedema, the odds are pretty good that it's going to be a little bit of a battle. Some people, it's horrible, horrible, horrible. Some people, it's just irritating. Okay. So no judgment either way. Some things that you can do, textbook things that you can do to maybe prevent that from happening a little bit. I'm just going to read, but if you want this list, let me know and I'll ship it to you, okay? So they say to elevate the arm for about 20 minutes at a time, a couple times a day. So 3 to 4 times a day, if you can get that arm elevated up onto something, that helps a little bit with the drainage, okay? If you know how to do self-massage, that is a wonderful thing for you to do a couple times a day too. Now, of course, those of you that have never experienced lymphedema, you might not do that much, but those of you that it's constant or it's flared up right now, you want to try to get that down as much as you can. If you do not know how to do that, I can send you a link to probably the best one I've seen is a hospital out of Toronto that has a really good explanation of how to do that. I would show you a bit of it, but I'd have to kind of have less clothes on and it gets a little intimate as you're going down. One thing I want you to keep in mind if you are doing that when you're doing lymph drainage, it's a very soft movement, right? So the lymph nodes are just under the skin. So we have a tendency to want to push to the muscle and move. Okay, that's not what you want to do. That's a totally different purpose. That's a massage for your muscles. Lymph drainage, if you use a little bit of baby powder, sometimes that helps. It's a very soft, feathering touch. You might, if your skin my skin is quite tight, so for me to actually move the skin is a little more difficult than some people, but you're being very, very soft and feather-like with your movements to get that drainage to move, okay? Some other things to keep in mind. You want to avoid getting cracks and cuts. Even something as simple as a hangnail can be a huge issue for infection. And what clears up your infection, right? So think about that for a second. So you really want to keep moisture. You want to keep the area moist. You want to be careful about even your fingernails and your hands, insect bites, all those types of things. Okay. Be a little bit cautious about hot tubs and saunas, extreme heat. Okay. So whether that is when you're bathing, a hot tub, or even when you're doing dishes. Okay. Limit the sun, of course, sunscreens, things like that. Watch for any signs of infection, especially around the fingers and the hangnails and stuff like that. We all know those, right? Red, swollen, warm. Use a sleeve and make sure that you're definitely using a sleeve when you're doing your strength training. So Carol, you're always, when you're in the gym, you've always got that sleeve on. That can really, really help, especially when you're having a flare up. Okay, you really need to make sure you're using those sleeves. Avoid tight jewelry, okay, around the wrists, or even tight elastic bands like shirts. Sometimes we have the shirts that have an elastic cuff. Avoid that kind of thing if you can. When you're doing exercises, you want to, especially with the upper body, obviously, you want to make sure you're doing the breathing first to open up the spaces where the lymph would go into, okay? Because that drainage has to go somewhere. Okay, and if you have the opportunity to ever work out in water, that is because of the hydrostatic pressure around the area and the gentle movements you're going to get in that water, it's one of the best places to get some things flowing. Okay, so what I'm going to show you, and again, if you want that little list, it comes straight from CETI, which is basically where I was trained for a cancer specialist. Okay, so we are going to do a tiny bit of drainage work. Okay, so the first thing you always want to do when you're doing any kind of lymph work, not manual, but on yourself, you need to breathe properly first. Okay, the lymphatic fluid has to have a place to go, and opening up and breathing first is key to doing that. Okay, so even with your breath, you're getting drainage happening and starting. Okay, so the proper way to breathe, I like to do this when I'm laying on my back, to be honest with you, but if you're going to do this 2, 3, 4 times a day quickly, this first little bit, you might as well just stay seated. Okay, so you're going to relax your body, let those shoulders drop down. If you're wondering what a natural position for your shoulders is, it's the bottom of your sigh. Okay, so just right there. So you don't have to force your shoulders down. You just sigh. Okay, so everything should be nice and relaxed, nice tall posture, feet flat on the floor if you can, head nice and tall. Okay, and you're just going to breathe in through your nose. And as you breathe in through the nose, I want you to concentrate on letting that air go to the bottom of your ribs and expand your stomach. Right there, we're moving lymph. Okay, we are opening everything up. And then you're going to slowly exhale out your mouth as if you were flickering the fire on a candle, the flame on a candle. You're not blowing it out, you're just flickering and playing with it. All the way out. Feel your whole body just collapse into that. Okay, and let's try that again. So breathe in through the nose. Really open everything. You can feel even your collarbones expand. Everything expands with that inner breath. And then slowly exhale, letting everything collapse. And then try that one more time. You usually want to take 2, 3 more if you're stressed. Expand, let everything outwardly move, and inhale, let everything shrink. Or exhale, sorry. Got caught up on my breath. Okay, good. So you always want to start with those breaths to get everything going. Okay, so the first thing you're going to do is simply, Bring your palms up. Okay, so you're 90 degrees. And you're just going to drop your arms down. It's very gentle movement. You are not tensing. So when you're exercising, you're tensing. You're very relaxed, very meditative. Drop down till your arms are straight and then gently come up. So it's very gentle. Come up to that 90 degrees. Back down. You want to do this about 5 times. Nice and slow. No tension anywhere at all. So if you have a hard time getting your arms to go up, they're tired, just lock your elbows in there. It'll help you a little bit. Use your breath as much as you want. Okay, so after you've done about 5 of those, you can have just a tiny little rest. You want to do that up to about 3 times. Okay. So then get ready and just try it again. Now, when I say do it 3 times, if it's becoming more of an exercise because your arms are really, really heavy, then you just start off with 1 and you work your way up. So I'm just going to do 2 sets of everything today. Perfect. Okay. And give yourself as long a rest between as you need. If you want to take a breath in between, whatever you want. Okay. The second part you're going to do is to have your palms rotating. So you're going to come with that 90 degrees again. Okay. Nice tall posture. Everything is open. And you're just going to rotate and rotate. Remembering again, you're not exercising. You're moving and allowing your lymph system to drain a little bit. It's a little bit of a gentle massage. Okay, so up and down, that is 1. Okay, so you're going for 5. Good. Give your arms a little tiny bit of a rest between. Have some water. Always, always, always drink water. Okay, try another set. So this is easily something you could do a few times a day while you're watching TV. Perfect. Beautiful. The last one we're doing for the drainage is a little bit of work with the wrists. So basically what you're going to do is come up, palms down, and you're just going to go down and up. That's 1. There you go. Give yourself a rest, a little bit of water. If that's all you can handle for that particular session or that particular day, you don't want to overdo it or you're actually going to cause more fluids. Okay. And then if you're ready, come up again. It's very simple stuff. It's a matter of doing it. Perfect. So that part is the lymph work that you need to do a couple times a day. So it was as simple as you're breathing and then you're lifting, rotating, and out here, up and down. Okay, that's all you need to do. I'm going to give you a few exercises that can help sometimes loosen up some of that scar area if it's fairly new, and with some movements. Okay, so the 2 main movements that we can do with our shoulders and arms are called retraction and protraction. And retraction is basically getting the shoulder blades to squeeze together very gently. So most of you that work with me, you know your retractions and protractions, just in case somebody new is watching. So what I'm thinking about is my shoulder blades are here. I'm thinking about the tips, the bottom tips of my shoulder blades as kind of pinching and coming down. Now, when I'm exercising, I'm pinching pretty hard. With this, all I'm going to do is pretend that I'm pulling something. Okay, and I'm just going to squeeze those shoulder blades down. And what you should notice with that is some pulling in here. So depending on your scar tissue, you might feel some real pull in there. It might feel a little pinchy. If you have been cleared to exercise, it's okay. A little bit of stabby, pinchy, scar tissue, you got to go through it, guys. Okay, so that retracting, release, retract, release. So I'm not moving my shoulders. My back muscles, they're pulling down, are forcing my shoulders to stay open, working on that chest, pulling a little tiny bit. Okay. Okay. So usually do, again, 3 sets of 5 if everything works. That's a good little movement to do. Okay. Another movement is the protraction. So when you're protracting, you're reaching forward. So there's different ways you can do that. I'm just going to give you a simple reach. So you sit up nice and tall. Okay. Your spine is tall and you come here and then you just push that little extra inch. Okay. And then come back in. So you go here and you push that little inch, that little extra inch. So when I push that inch, I'm coming forward, my shoulder blade is coming forward, but my body isn't coming forward, okay? I'm not collapsing, I'm not leaning, I'm here and I'm allowing the serratus muscle, so the muscle that's right down in here, I'm allowing that to be worked a tiny, tiny bit, okay? And that may, again, feel really uncomfortable. Another thing you can do, if that is uncomfortable and you need a little bit of stability, is grab, this guy's a little too big, okay? But grab a ball or anything like that that you can do, and then just reach around that ball a little tiny bit, and then come back. And reach around the ball a tiny bit and come back if you have to, okay? Whatever works to get you that little tiny pull under here. Again, 5s. Okay. The other thing, a little more advanced if your body is ready for it, is some wall crawling. Okay, so what you're going to do, again, you may just be doing the first part of this. You might not be ready for the strengthening stuff. You're going to stand near a wall. Go away. You're going to stand near a wall. You're going to put your hand against the wall so that you're about arm length away. And you're going to slowly start creeping up. If you have a hard time with doing the creep up, you can do a slide too. You slowly start creeping up with that straight arm if you can. Maybe you can only come to here. Maybe you can come higher. Again, if you've been okayed, it's going to pull. Okay. See if you can come up as you get closer and closer and closer and closer, and hopefully flat against the wall if you can. And then you just hold that for a little while if you can. Some of you are going, holy hell, that pull. Some of you are like, oh, no, that's good. Okay. Pinchy, stabby, pulley, scar tissue, got to work through it. Okay. And then you crawl yourself away. So again, this would be 5 times. I have a hard time crawling down. I got to slide down. I don't know what, my fingers aren't coordinated enough. Just to there. And then you're going to go up again. Getting close to the wall. So you're really using that wall to support the upper part of your shoulder. You're really getting that stretch underneath. That's what you're looking for. Okay, and you can hang out here for a while. You don't have to go back and forth. Okay, this is just a nice little opening position. For some of you, it's not. Some of you, it's like, oh, this is cool. Okay, so again, you're going to do that on both sides 5 times. And it doesn't matter I only did this breast. I like everything balanced on both sides. You don't want to have that great mobility here where this guy's all jammed up and tight. So always do everything. It's to your benefit to do that. Okay, so you come closer, 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 closer. Stretch. If you can't hit the wall now, that's okay. We'll work on that. If you want to, how long do you want to hang here? Honestly, if I'm doing this, I like to hang there for about 30 seconds if I can. okay, to really get that nice pull. Okay, the last one you're going to do is also a slide, but it's forward, so it's a little trickier. So you're going to come with your hand out this way, okay? You can slide up as you come closer, 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 closer. Try to get yourself right against there. If that hurts the breast at all for any reason, or whatever you have going on there, then adjust, okay? But hopefully that's not an issue. But the pulling sure might be an issue. Okay, so right up there. Try to get yourself right in there and feel that forward pull into here, okay? And you're gonna do the other side as well. Again, you might be right here. This might be where you are. And that's like, holy hell, that's enough. And then maybe next month you're here. Or maybe next week you're here. And then eventually you're here and you're like laughing. This is easy, easy peasy. Okay. So again, I would try to work myself up to 5 of those. And then eventually maybe 3 sets of 5. And eventually, you know, you're not going to need it. Okay. So the other thing I want to talk about is the scar itself. So some things, as long as you have very clean hands, you're okayed, it's fully healed, and all you have is a scar, you can work that scar a bit. And the benefit of working the scar a bit is we know that scar tissue, depending on where it's placed, can be extremely painful and extremely limiting to your movement. It holds you, right? It's like, I gotta get that loose. So there's a couple things you can do to your scar. I'm gonna show you my lovely leg here. Okay, so a few years ago, I went to Hawaii and decided to fall down and ended up splitting my knee here all the way around. You can see that lovely scar that keloided, so it's wide and ugly. So ignore that part. But it went right to the knee. And I had a scar about as thick as my finger under there for the first little while. So as soon as it was healed and I didn't have to worry about touching it, infection, anything like that, the top part was healed over. What I started doing is self-massage for that. Okay, so you can do the same thing if you get into that area and you find that scar. So you want to just use a couple fingers. Okay, you got to be careful. Don't get near the lymphs and stuff. Just basically what you're going to do is little circles. So I'm taking my fingers here. Sorry, my bandage here. It's actually tape. And I'm going to make little circles. Okay. And I'm going to do that as much as I want, really. I would sit and watch TV and do it for quite a while. And then I'll move down, little circles, all the way down. You're going to find some owies in there, possibly. That's okay. Grin and bear it. Go all the way down. The other thing that I did, and I did this one more, is cross-friction massage. So I went kind of like a little ziggy-zag. Okay? So I just went cross, ziggy-zag, ziggy-zag, cross, 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 cross. And I would go all the way down, not quick like that. They would be slow motion. I'd maybe spend 5-10 minutes or more. And I'd go all the way down. And luckily, if you were to feel my scar right now, it looks bad. You would not, if you closed your eyes and went along, you would not know that there's anything under there at all. I have a tiny little bit of excess, more of excess skin right here, but there is nothing. Okay. At first, this was so painful to touch. It was crazy. It was nervy. I have full feeling. Okay, which is a nice thing. That takes years sometimes, just so you know, to get back. And I have nothing under there. It looks bad, but there is no feeling. And that's what I want, because I have full range of motion. If I kneel on it, it doesn't bother me at all. That's not what I thought was going to be the case. So if you can get some of that scar tissue worked out, that will give you more mobility. And when you do maybe put a bra or a shirt on and it's rubbing against it and it's nervy and it's like, that's horrible. If you can get some of that to be gone, it may take, again, years to do. Start now, work on it. Okay. So again, that's about all I've got for you right now. If you want that self-massage, self-drainage work that you can do, it's really nice to do, actually. It feels really good. Just shoot me a message, either private or on there, and I will pass that on to you. Okay, so take care of yourself, drink plenty of water when you're doing any kind of work that might be playing with your lymphatic system. And eat healthy, all those kind of things. You guys know what to do, but that will hopefully give you a little bit of relief. If for those of you, especially that are in treatment right now, are post surgery and can't get in to get your appointments, you're going to have to take it into your own hands and do some work yourself so that you don't end up. Another reminder, just because you've never had lymphedema and it's been 20 years since your breast cancer does not mean that it can't pop up suddenly. So keep yourself moving. Okay. Have a lovely day. Any questions, shoot me a message and I'll do my best to take care of that. Okay. Thanks, guys.